Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Different pain relief systems for men and women. In a new study evaluating meditation for chronic lower back pain, researchers at University of California, San Diego School of Medicine have discovered that men and women utilize different biological systems to relieve pain. While men relieve pain by releasing endogenous opioids, the body's natural painkillers, women rely instead on other non-opioid based pathways. Synthetic opioid drugs such as morphine and fentanyl are the most powerful class of pain-killing drugs available. Women are known to respond poorly to opioid therapies, which use synthetic opioid molecules to bind to the same receptor as naturally occurring endogenous opioids. This aspect of opioid drugs help explain why they are so powerful as painkillers, but also why they carry a significant risk of dependence and addiction. Dependence develops because people start taking more opioids when their original dose stops working, said Farrell Zedin, PhD, Professor of Anesthesiology and Endo, Professor in Empathy and Compassion Research at UC San Diego Sanford Institute for Empathy and Compassion. Although speculative, our findings suggest that maybe one reason that females are more likely to become addicted to opioid is that they are biologically less responsive to them and need to take more to experience any pain relief. Surgical team fails to rescue female patients 10.7% of the time. JAMA surgery. Despite having no greater chance of developing problems after high-risk cardiovascular surgery, women are more likely to die than men from post-operative complications. A University of Michigan-led study suggests men and women had a similar rate of complications after an operation, around 15%. However, women died of those complications at a significantly higher rate. Surgical team failed to rescue female patients 10.7% of the time compared to 8.6% for female patients. The results are published in JAMA Surgery. Researchers found a similar pattern in the failure to rescue rate for each individual procedure. The most common complications for men and women were kidney failure, pneumonia, and lung failure. In fact, women in the study were more likely to receive surgery at hospitals that traditionally take on a higher volume of high-risk surgeries. These high-risk procedures are inherently expected to have higher complication rates, but patients are still expected to have a positive outcome if the complication is managed quickly, said co-author Gaurav Ailavadi, MD, MBA, Chair of Cardiac Surgery at Health and a Director of the University of Michigan Health Frankel Cardiovascular Center. In our study, female patients had a lower rate of reoperation than males, he added, using a term to mean a second operation within days of the first. This may not be due to a lower need for reoperation, it could instead be a signal that their complications were not appropriately addressed. Folic acid can mitigate lead's impact on autism risk during pregnancy. New research gives another reason to take folic acid supplements while pregnant. A new study by Simon Fraser University researchers has found that folate may weaken the link between blood lead levels in pregnant women and autistic-like behaviors in their children. Researchers from SFU's Faculty of Health Sciences, led by PhD candidate Joshua Alampi, published the study in the journal Environmental Health Perspectives. Folic acid supplementation during pregnancy has numerous benefits to child health, especially brain development, says Alampi. Our study suggests that adequate folic acid supplementation mitigates the neurotoxic effects of lead. The SFU-led study is the first to observe that adequate folic acid supplementation may reduce the risk between gestational lead exposure and autism. It found that association between blood lead levels and autistic-like behaviors in toddlers was stronger among pregnant women with less than 0.4 milligrams per day of folic acid supplementation. New blood test may detect early signs of heart attack in 5 to 7 minutes. With heart attacks, every second counts. A new blood test diagnoses them in minutes rather than hours and could be adapted as a tool for first responders and people at home. The proof of concept work, which can be modified to detect infectious diseases and cancer biomarkers, is newly published in Advanced Sciences. Heart attacks require immediate medical intervention in order to improve patient outcomes, but while early diagnosis is critical, it can also be very challenging and near impossible outside of a clinical setting, said lead author Peng Zheng, an assistant research scientist at Johns Hopkins University. We were able to invent a new technology that can quickly and accurately establish if someone is having a heart attack. Zeng and senior author Ishan Barman developed diagnostic tools through biophotonics using laser light to detect biomarkers, which are bodily responses to conditions including disease. Here they use the technology to find the earliest signs in the blood that someone was having a heart attack. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.